Please
Hello,
start.
friends. Okay. My screen is visible, sir.
Yes.
Okay. So, good evening, friends. Once again, today we are not going to discuss any particular topic, but we are again going to discuss about working on a Google Sheet, that what is being done and what is still remaining to be done. So it is very important that group leaders, they should be on the board today, right? At least. So I see some of the group members are already there. All right, Dr. Prina, Dr. Prakash, Dr. Nagaraj. Okay. So I see hands right now. So is there any message you would like to convey, Dr. Prina? You can unmute yourself. Dr. Prina, you are self-muted. Would like to say something? Or it is some technical?
I'm not very sure what we are going to discuss today. Working on the Google Sheet is okay, but I thought we were going to discuss what we are going to submit to the MCI very soon,
Yes,
not
yes.
the SLOs. You said we will not
No.
be uploading the SLOs yet, but we have to submit
Yes.
the working hours and all that.
Yes, definitely. This is what we are going to discuss, and I'll show it to you what exactly we are planning to do. Okay. Okay, friends, if you see, these are the competency which has been prescribed by Medical Council of India. We started working on that. This is the thing which we would like to complete it as soon as possible, but I see there are two systems, GIT and hepatobiliary, and Dr. Shyamala and group has not completed the activity. And over here, respiratory system is also remaining. So I request the group leaders and other group members that if you please do it in the next week, probably in just few days, it will be very good for us. So then we'll be able to move ahead. Over here, if you see, there are 80 lectures already, right? In lecture, total number of lecture is 80. We are exceeding the lectures, and MCI guideline is only 70. So we need to trim down some of the lectures over here, and still we don't have GIT and respiratory system lectures. This is still being remaining. If you look at over here, the small group learning, and you can see as per MCI, it is 110 hours which are dedicated, and we are already crossing that to 182. So it requires a great bit of trimming of this small group learning, right? So small group learning, these hours include this also, small group learning and DOP. Small group learning can be anything like demonstration, practical, but DOP is specific, we have separated out. So this both in combination is making 182 hours. So it is our, once again, a very important task that which we have to reduce down to 110. Self-directed learning, if you see, MCI has suggested 10 hours only, and our module is already 34. So great bit of reduction over there, especially I see in Zoonotic 2, there are 8 self-directed learning. So I don't know how this group is going to work on that, and they need to reduce it down. We can in total have 5 self-directed learning sessions, right? Only 5 out of whole microbiology. So it will make up 5 multiplied by 2, it will be 10. 70 lectures multiplied by 1, that will be 70. Then small group learning will be of 2-hour session, right? So if you put it over here, the session should be something around 50 to 55, right? So 55 sessions of small group, including DOPE, and 5 sessions of self-directed learning. So that is why we were discussing there are several things to be cut off, especially if you are discussing many things about the organism, their culture characters and identification. There are several things which needs to be cut down, and then we'll be able to meet this MCI guideline, the total allocated hour. I request that once you do that, this is what we are planning to do, right? Over here you can see immunology. There are lectures, then demonstration, self-directed learning, and these are the sessions, right? Immunology session will start with a lecture of immunology, that is introduction. Then structure and function of immune system lecture, antigen antibody property like that. Then over here there is a demonstration of immunology and serology test. Then there is a tutorial on immunoprophylaxis. There is a self-directed learning module for immunoprophylaxis. Once again, it will start with the lectures and then it will end with part and exam. So this is how immunology is going to be taught to the student. And you can see over here, it is being reflected over here in immunology. There are 13 lectures. There is small group learning. There are no DOP. There is one self-directed learning, and these are total number of sessions are 17, right? So this is what I want all of you to complete as a group leader and a member of a group. Then if you move over here in our SLOs, right? Once again, you can see now detail of this will come. First of all, these are the teaching hours, followed by this teaching schedule, and then it is followed by specific learning objective. So over here you can see that my first session was on introduction or immunity. And in immunity, this is a lecture, and following things I plan to teach them in 1 hour session, right? And this particular competency or the session is about, you can see over here, it is about a domain, that is knowledge, level, that is know-how. Teaching learning method would be lecture, right? So over here, is it very clear that this is only one session SLO, and the whole session is to be conducted through lecture. This is the detail about second lecture, and these are the SLOs for this. Then third one, then the fourth one, the fifth one, sixth one, 7, 8. Over here you can see now demonstration, right? And these are SLO only for this demonstration. Explain the principles of tests applied for diagnosis of infectious diseases. Choose appropriate tests for diagnosis of common infectious diseases. Then once again, you can see we are moving at a lecture. Now self-directed learning. Now this will be a module which will be prepared by individual department, and our objective for this module, the student should be able to achieve all these objectives, right? Then once again, you can see the lecture, 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 lecture. Okay, one seminar. Over here, students will be presenting a seminar about different common clinical transplantation, right? As for example, the group 5 or 6 group will come, and the group members will present one by one. One will talk about heart transplantation, one will talk about lung transplantation, one will talk about corneal transplantation, like that. One will talk about kidney transplantation. So there will be a 2-hour session, and that will be the student seminar, right? And once again, last, you can see over here is a lecture, right? Over here, you can see transplantation is also being taught by us, but that will be the basics of transplantation. The clinical transplantation will be taken by the student. So this is how we'll have to plan our SLOs. So first, once again, I'm repeating your overall plan. How many lectures would you like to take? How many small group learning, DOPE, self-directed learning. Then you come over here and you should be able to give, this is very important, right? Because this is what we are supposed to give it to Medical Council of India, right? Sessions along with our competency. I'll show it to you. Then our detailed plan, of individual session, our SLO is being prepared like that. Is it very clear? So if we go,
Yes.
okay, if we go, then you can see over here in CVS, this session, we are talking about this SLO, right? And this SLO should not have individual component like this, knowledge, domain, level. It is about only one session. If you are taking one session, we'll have to name this session. And this name of this session should have individual SLO, right? You cannot have this in one session. It is not very clear. You are talking about interactive lecture, we are talking about small group, we are talking about small group. Then you can see it is to be planned like this one, immunology. You can see over here that competency divided into sessions, and each session is delivered by one particular method, and that particular session is having specific objectives, right? It's very clear. So CVS work is to be done for that. If you go to GI, over here also you can see in one particular session there are several teaching learning methods which are being put together. So we need to separate it out that for this particular competency, if you are taking one lecture, what will be the topics or what will be the objective for that lecture, followed by one small group learning, what will be the objectives for that. Like that, this also needs to be done. Then we go to this one. This is soft tissue, right? Over here, okay, they have done it like that. This is the session, anaerobes and anaerobic infection, and these are their SLO which is being defined very well. So over here, this is the method that self-directed learning. But self-directed learning, if it is followed by a group discussion, there has to be a group discussion of another session. Because self-directed learning is to be done at home. And when they come, you'll have to again spare another session, which will be a small group learning, right? It is clear? Over here, it is right. Interactive lecture, and these are the objectives of that particular lecture. Okay, if we go to CNS, yeah. If you see the CNS, this is the competency, and these are the sessions, and sessions should have a name specific, right? And these are not specific names. Introduction to infective syndrome, etiology. You cannot have a session on etiology, right? You cannot have a session on root of infection. You cannot have a session on clinical finding. Session would be one, right? As it has been described by some systems like immunology. Once again, I'm saying the session is immunity introduction. It is to be taken by lecture, and these are the objectives which need to achieve. So over here, CNS, once again, a group will have to rework and we'll have to find out that what the session number 1 they would like to take it. We cannot have this multiple, right? Lecture, if you take a lecture and you take this one and then clinical finding this one, no, it is not like that. We'll have to give, or what we can still have to plan meticulously. A macro planning is still remaining. Then respiratory system, okay. Yes, they have given the name substation, that is very good. Introduction to URTI, they are going to take a lecture, right? So lecture, we write over here lecture, and these are the SLOs of that lecture. Good enough. Over here you can see it is a small group discussion, diphtheria, and these are the SLOs for that. So one session, one method, and there are multiple SLOs. That is good enough. But over here, don't mix multiple methods, because one session is to be delivered by only one particular method. Okay, good enough. They have done it good. Respiratory system. We move to next, genitourinary. Okay, over here also, it is very good defined. You can see the first session would be genitourinary infection introduction, and these are the SLOs for that, and that would be delivered by lecture, right? Very similarly, there is another lecture of syphilis by syphilis, another lecture gonorrhea, a lecture of genital herpes, then small group discussion. Very good. Over here, the session we need to name management of STD, like that. It has to be small, because then and then we'll be able to put it in our timetable. The whole name of that, we don't want this competency to be over here. but we want the name of this. This is genitourinary infection, syphilis, gonorrhea, then genital, or we'll have to name this one. STD3 you can write, no problem. Like this, we'll have to give the name of a particular session, but otherwise this is good, right? Zoonosis 1. Okay, over here, yeah, zoonosis 1, once again, they'll have to specify. You are not supposed to write the number of sessions, but as it has been explained in immunology, suppose there is one lecture followed by one small group learning, followed by a DOP, that has to be specified. Session 1, lecture, and these are the objectives of that particular lecture. Session 2, that is practical as for example, what is the session, and give objectives of that, right? That is how we'll be able to complete, otherwise it is not possible. Once you decide how many lectures and practicals would like to take, then you put everything in our first, that is teaching hour. Then you put it in our timetable, that is initial schedule, which we have shown to you. We move to the next one. Okay, over here it is good. The first session, okay, we have to rename the sessions, right? It is not competency, it is the name of a session. So what exactly a small name which you can give to this competency rather than describing competency, and this will be putting in our timetable, and these are the SLOs for that particular session. Okay, this is good one. But over here you can see we cannot mix lecture and small group discussion. There has to be first lecture, then another second session would be of small group discussion that we need to do, right? Once again, over here there will be one lecture followed by another session, that will be group discussion, right? So this is how we are going to plan. Once again, our next plan of action would be this one, right? Immunology, lecture, small group, DOPE, self-directed learning. Then we put it over here, immunology, right? How we are, these are the names, session. And then we come to SLOs of individual one, right? That will make our list complete right from the top up to bottom. Once we do that, once our this one is ready, right? This is what our just bear for a few minutes. I'm just trying to find out where is the timetable. Timetable, monthly. Okay. I'm just trying to show you the timetable which we are in the process of preparation. Okay, right now I'm not able to find it out, but definitely, okay, if it is there over here, let me, no, it is one and the same thing. Okay, so I'll show it to you next time. I think I'm not able to find out today, but this is how you can see alignment has been tried by our 4 department, right? This is about general system wise we are trying to align, and this is what we have prepared, right, from October, November, December, January, February, March, April, May, June, July, August, September, right from their admission, rather passing from first MBBS to uh, examination. Right? Okay, we are also planning for this clinical posting. Sorry, friends, I'm not able to locate the timetable which you are preparing. Probably it has been moved by somebody from our group. So over here, we are once again back, and let us have some discussion with other group members. Definitely in the next week, probably Tuesday, I'll show you the timetable exactly how it is being prepared and what we are supposed to write. Okay. So if group members are there, what their plan is about. So let us have some discussion on that. Dr. Mukesh Kumar. Yes.
Good evening, sir. Good evening, sir.
Yes, good evening.
Hello.
Please. Yes.
Yeah, sir. Actually, what that even I was thinking about the time because we are exceeding the what the it is given by MCI. So whatever the MCI is given, accordingly we can modify our session plus the number of SLOs, sir. I think there we have to minimize it because whole things we cannot write on the timetable as you said, sir. So can we go according to them? If it is there written as a lecture, so we'll make it as a lecture. If it is written as a SD or slash, options are there. Accordingly, we can say either DOAP or a small group discussion like that, sir. Then I think it will be easy for us to come to the exact number 110, 70, what they have assigned to us.
Definitely, what you said is very right. I think initially we discussed that we'll have to come out of Atlas syndrome, that we are there to teach them everything, right?
Yes, sir.
Because
Yes, sir. Yes, sir.
MPI is giving only 180 hours, and within 180 hours, we are supposed to teach them. And that is why we said there are several things which need to put it aside, especially the as we discussed at several points, that all organisms and their individual culture characters and all things, right, that we need to, all group members and group leaders will have to once again decide and trim their sessions. Otherwise, it won't be possible to complete within 1 hour. Sorry, 1 year.
No, very difficult, sir, because there will be repetition and carryover. All those things will be there, sir. We need to be as specific, and as we prepare the SLO, whatever has been
Yes.
taught, we need not to repeat it in the next class because we will not able to finish 1.5 year course in 9 months. Actually, we are getting 9 months, not more than that also.
Yes, only
Holidays.
9. I'm showing you once again. I'm showing you what exactly how many. If you can see this, when we try to put in everything on a paper, this is what is going to happen, right?
Yes, sir.
Okay, you can see over here, right? October.
Yes, sir. Yes.
Now Diwali vacation has come in between, right? End
Yes.
of January, you'll have internal examination, right? Once again,
Yes,
there
sir.
will be a summer vacation that we forgot to put it. It will come once again, right? So
Yes, sir. Yes.
internal exam, and over here there will be a prelim exam. August, September is totally lost. Right? So
Yes, sir.
hardly we don't have that much time for this particular thing.
Yes, sir.
This is our general timetable, and in which we have started putting the particular topic. Right? This is what we have decided, and this is how we are working on that. But we already prepared 4 months of timetable. I think it is right now not being seen over here. So definitely next Tuesday I'll find it out and we'll show it to you how the timetable is being prepared for first term. Yes.
Yes, it will be
Dr.
easy for us to make also, because we also planning to make, sir. So it may become difficult to put everything, all this horizontal, interdepartmental, difficult to put all those topics, sir.
Yes,
So,
yes, very right.
Very helpful.
Monday and Tuesday, Medical Council of India has organized online CISP program, right? So I am attending that, and by I think Tuesday we'll be able to know if there is something new in that. So Tuesday once again we'll have a discussion about that, and I'll also show you the timetable. And if time permits, we can also have a discussion about case-based learning and linker. Right? So
yes, sir.
yes. Any other member would like to once again come inside and would like to? Dr. Prakash is there. Yes, Dr. Prakash.
Hello, sir. Good evening, sir. Sir. Regarding the SLOs and other things, sir.
Yes.
Yeah, sir. If you only allot that this many hours will be allotted to each respiratory system or other system, approximately if the group members can restrict to that, it will be better, sir. Instead of that, if each one of us do again reduce it and then come back again and then again talk the same thing, it will be prolonging the time, sir.
Yes, very right. I think what we can do, either we'll prepare another group, WhatsApp group.
Yes, sir.
There is some noise coming.
Yes, sir. So if you can do that,
yeah, definitely.
So it will shorten the time, sir.
Yes, yes. I'll make a group of all our group leaders, and in that we'll discuss. And we have already prepared that our timetable. So I can give you a probable number of lectures and all group learning, right? So we can reduce the time. By next coming weekend, we'll be able to complete this exercise. Right? That will.
Yes, sir. That's true. That's true. Yes,
Dr. Preena.
Yes, sir. Can I suggest something, sir?
Yes, surely, sir. This is our common
platform. If the number of lectures is exceeding 70, we have to merge certain sessions. For example, in general microbiology, we used to take a lecture known as Introduction and History. If you remember, that used to be the first lecture we used to take, Introduction and History. So we can combine 2 sessions. For example, in immunology, we used to take autoimmunity and immunodeficiency together. In our even when we had so many hours, then we could combine transplantation and cancer immunity together. You know, these are topics which microbiology doesn't have to teach in so much detail: autoimmunity, immunodeficiency, transplantation, tumor immunology. We used to combine these 2 topics, and that will we have to go competency by competency and reduce the sessions by merging certain topics into one session.
Yes, definitely.
That is what I have done. In my we had prepared our SLOs about a month and a half back. But by interacting, by joining this group, I have learned so many other things. So I am revising my total SLOs and names of sessions and everything. And my total is coming to 72 because I have merged certain topics.
Yes, definitely. I think, Madam, will once again come on a common platform, another platform, and we'll have a consensus of number of hours dedicated for a particular system, right?
Yes.
That we will be doing as a member. Yes. All group leaders will combine and will identify and will dedicate that hours, right? And according to that, group will cut down the sessions and SLOs. Right?
We can't do away with the session, but we can merge them.
Yeah, definitely. Basically, two sessions are merged into one. It will become one session, right?
Yes, sir.
Yes.
And in 1 hour, we have to teach it.
Yes. Definitely. That will do, madam. Very surely.
Yes.
Right.
Yes.
There are certain systems, and especially I think I don't see Dr. Shyamala is not there, and that work is pending. And if right, one is GIT, and Dr. Fatima, I think she must be working. Probably there is some problem, but her system is complete. Probably the number of sessions are over here to be written. So, and if Dr. Shyamala is not able to do that, we can ask some other group member to come forward and complete the session, or we can take over that, right? No problem. Right. Any other suggestion from the group members?
So the total number of hours mentioned here is 180 by MCI, but it is actually 190.
Yeah, 10 of this one. Yes.
Yes.
10 is
So this is
self-directed.
190.
Yeah, but I have not put it over here because the problem is that self-directed learning, there will be no session during teaching learning, 9 to 5, because they are supposed to do at their home, and we'll have to provide all resources, and they'll be just completing the task. If you want to have a session, yeah, if you want to have a session, you'll have to dedicate the session over here also. That will be the problem. And if you put it over here, you will be cutting other system session. That is another problem.
That is true. Okay,
Yeah.
so it's 180.
Yes. We'll have to be very sure that self-directed learning, they do it at their home only. Is there any member would like to comment on that? Would like to say something? There is some question by Dr. No questions there. If somebody would like to say something, they can unmute themselves and.
Yeah, Sanjay sir, if any work will be there, I like to do it. If no member will be yeah, somebody will be busy in some other work, I love to do it if any task will assign me, sir.
Dr. Mukesh Kumar.
Yes sir, yes sir. If any task will assign, I'll do it, sir. If any the group leader may be absent or somewhere they will be busy, in that time I will do it, sir.
Surely. We'll keep you in our group. It is a very gentle gesture by you, because many of the faculty members are involved with COVID duty, and that is why they
Yes,
are
sir.
finding. Yeah. Dr. Nagraj
Yes,
would
sir.
like to say something. Dr. Nagraj, you are self-muted.
I want
Yes.
to say that there are some topics like virology and all these things. Actually, there is an overlapping between zoonosis 1 and something there, especially in some of the diseases which are they're common. I think there we can cut a lot of topics there, sir. We have to make it as one.
Yeah. There are several
That
things
is where
which.
a lot of overlapping is there.
Yes, you are very right, and that we need to slim down. I think we find
Correct,
we decide the
But
deadline.
play in not in the last part or in the first part.
I'm not. Can you again repeat what you said, sir?
To do, or you want to do it on the zoonosis and things like that. When you come to the 8.1, 8.2, whether we shift it there as a syndromic approach or whether you are going to do systemic. I think that will take care of most of the overlaps, I think.
Yeah. That will be fine. That will be fine, sir. We'll have to do that only. Dr. Nagraj, you will work on zoonosis 1, and Dr. Prakash will work on zoonosis 2. That will be fine, because
Sure, sir. Sure, sir.
yeah.
Sure, sir.
I'll make another group of all group leaders, and we'll start working on that. And we fix the deadline that by next Saturday we all should complete this exercise, and we should have complete teaching timetable ready. Right? Do you all agree with me, Dr. Mukesh Kumar, Dr. Nagaraj, Dr. Prakash,
Yes,
Dr.
sir.
Yes, sir. Yes, sir.
We agree.
Yes, sir.
Yeah, Dr. Preena also, right? She will be also be there along with it. Yeah.
Yes, sir. We will agree, sir, for that.
Okay. So I think we can close the discussion today, and I'll immediately soon after we'll create a group and we'll add all the members, right? That
Yes,
will be
sir.
good.
Yes,
sir.
And we can have a discussion, and Tuesday we'll discuss about is there anything new in CISP, and by Saturday we'd like to complete this activity. Next 1 week we'll complete all activity, right?
Sure, sir.
Right,
Sure,
sir.
I
sir.
think Dr.
Right.
Thank you, sir.
Thank you.
Okay, so
Dr.
Thank
Sanjay,
you.
yes, sir.
I just wanted to make a comment. I mean, in other subjects, what I understand that there is some part of SDL, the people are expecting that it should be done in the classes, and instead of students doing it at their homes during the something which was called practical class, and there are some SDL sessions also. Is there? Am I right?
It should not be there. According to me, it should not be there. I have seen even in our college also some of the faculty members are putting SQL. Now it is totally a self-directed learning. Ideally, you should have prepared your module and you should have given it to the student. You'll have to prepare that. Suppose there is a chapter of a book, there are published articles, there are videos, everything you deliver by some online media or some physical media, and you give them the objectives that these are the learning objectives. If you want to take a session on that, only session can be taken whether the objectives are achieved or not. Don't take them to the class and don't teach them everything. Don't allow them to discuss over there. If they want to discuss, they can come after 5. You give a place, they discuss, and then they achieve their objective. It is all right. They learn, they have a meeting, they have a learning. But you don't dedicate your teaching learning time, which will be cutting your time from other subject and other sessions, because we are having very short number of teaching hours which is allocated by the MCI. And that is why, as for example, immunology session, I'm going to give them the complete literature. There will be a video lecture which will be given, there will be a website which will be given, and there will be a resources that will be given, objectives will be given to them. And if you want to a session, you can have 1 hour session, and you can directly deal with whether the objectives are achieved or not. What we are planning to do them is to give them some assignment, and assignment submission will be done, and it will not require any face-to-face session. So it will become immunoprophylaxis assignment. After learning, they will be submitting to us. So self-directed learning is that you just guide them to learn, and they will identify what they are supposed to learn and how they are supposed to learn. Otherwise, putting them in a teaching timetable is a wastage of your teaching hours. That is the problem. And we don't have that much of liberty of.
Many teachers are of this opinion that some, I mean, in which, I mean, this definition has to be clarified.
It is already, I think, those who have gone for a FAMER, they know what is self-directed learning, right? And then
Yes,
self-directed learning, yes.
Okay.
Yes, but my view is very clear. We will not put it in our, we'll not put it as a routine teaching learning. We'll not be putting that.
Okay.
Yes.
Fine.
Dr. Momita sir would like to say something. Dr. Momita, you can unmute yourself. You can give your suggestion.
Yes, sir. Regarding this SDL only, I had the query. If if we are giving the material for them to go home and study, then why is MCI specifying that it has to be 10 hours?
No, it is minimum standard. See, they are learning
Okay,
at home. You can go for 20 also. There is no one is going to ask you why you are forcing your student to go for 20 learning. Only thing is that they should not be overburdened by all the subjects simultaneously. It is to be done.
Okay, sir. Okay, sir.
Minimum
Okay,
5
sir.
sessions plan out. Minimum 5 sessions.
Okay, so that means we have to give minimum that much SDLs in the throughout the microbiology course. Okay. Okay,
Right,
sir.
right.
Thank you, sir. Okay. And so one more thing, like in the sheets which we are working, for the systems. Hello.
Yes.
Can we
Yes.
have a column just for our working, a suggestion column? So sometimes maybe we may have written too much of SLOs, or maybe two sessions can be combined. So if any other person can give the comment or put up a query, so it might guide us. It was just a thought, a suggestion column in all the sheets where we were working.
Definitely, right now it has been created, right? You can
Yes.
go for
Hmm.
that, right? There is
Hmm.
one complete sheet in that. This is the first one, suggestions.
Hmm.
Anyone would like to suggest anything with regards to any system,
Hmm.
yeah, they can put it
Hmm.
over here, right, in this Google Sheet.
Yes, sir.
Right.
Okay. Thank you, sir.
Oh, welcome. I think, is there any question or query or suggestion from you, sir, Bedi sir?
Yes, this 10 hours, the question which ma'am asked, that 10 hours is minimum. So I mean, this means this 10 hours has to be given during the college hours?
No, no, sir, no, sir.
That those
This,
minimum 10 hours of SDL.
no, you should not do it. You should not do it.
I mean,
If you
even
want,
that
yes,
is at their home. Okay.
they are supposed to learn, and self-directed learning always happens outside of the class.
Okay.
Yeah. But you can have a session
Because
on.
I saw one model.
Yes, sir. Yes.
I saw one model in a different country, and there they had provided all these videos and books in a particular room, and the teacher was just sitting there and solving their problems while they were going through the videos and books on their own. It was
Yeah, yeah. That,
even problem-based session, but they were doing it on their own. I mean, that kind of SDL was also there,
the best
but
thing is
specified
then.
time was given.
But thing is that, sir, best thing is that you have to give the freedom to the student, right?
Yes.
You simply need to ask, provide a guideline, a semi-structured guideline. Self-directed learning, they should be able to identify what they are supposed to learn in immunoprophylaxis once you have given the list of objectives, right? What they are supposed to know. Ideally, they should go and identify the source for that also. But we are providing some source. Some of the source, it will be identified by them. But if you collect them into a class, it will become indirect type of teaching only. That would be a problem, and it will not be possible to provide all the resources in that one particular class, right? That will be very difficult. So, and second thing, they will be working individually rather than collectively. That is self-directed learning.
Yes.
But as there is no clarification, there is a confusion. That is what you said, very right. And there are different modalities for that. But this is what we are planning, and this is what I
Yes.
am planning, and that is I am going to go with that, sir. So I think we can call it a day, sir,
Yes.
today, and again meet on Tuesday
Yes.
with
Yes. Yes.
what
Please.
CIP2 has to teach us to us, right?
Yes.
Yes, sir.
Okay.
Yes, sir. Bye, sir. Bye,
Okay,
sir.
thank
Thank you,
you,
sir.
thank you.
Thank you.
Okay, bye.